Welcome back to Talk to Doc. I'm Dr. Oyi Balburias with Maricel Laksa Pangilinan.
Yes, to answer our queries about regenerative medicine is Dr. Sam Bernal. He's consultant advisor of the Medical City's Regenerative Medicine program. And he is also the man behind the treatment of former Labor Secretary Nieves Confesor's case. Hi, Doc.
Hello. Thank you
sir.
for having me.
Thank you for joining us. Alam ko maraming nakapilang mga pasyente nyo ngayon. Doc Bernal, tell us please, yung regenerative medicine is not a field of medicine that we often hear of. Can you please tell us what it's all about?
Yes, it's an exciting new field of being able to restore the body's own function. Many of the diseases afflicting us are the result of the breakdown of cells. Regenerative medicine, instead of relying on drugs or radiation or other artificial means, looks at ways for the body to be able to heal itself. So this uses advanced technologies of using the body's cells, called stem cells, using the body's own proteins, and using even the electrical activity of the body's own system to be able to restore organ function.
But how did you get interested in regenerative medicine, sir?
Well, before I became a physician, I was already a biochemist and an experimental pathologist. So I was looking at the way that the body itself breaks down and how the body attempts to repair itself. So I became interested in the applications to medicine later, after I started in the science of it. But it became to me a revelation that the body, in fact, has a very powerful way of being able to repair itself.
Yes.
And all we need is to help it a little bit.
Well, call it a twist of fate, but it worked out for Secretary Confesor that she met you and that she really needed this kind of treatment, diba, for her certain case.
Yes. Her type of cancer is very difficult to treat. And the basis for many forms of cancer is that our immune system breaks down and fails to recognize that cancer as being a foreign or alien cell. But the treatments that we have that are available, which I also use in the right circumstances, would involve surgery. And part of the problem with surgery is that even if you remove the major part of the tumor, there are still some microscopic cells that remain, and it's a matter of time before they come back. Another form of treatment after surgery would be chemotherapy. And a problem with chemotherapy is that the cells often, from the very start, are already resistant to the chemotherapy. And even if they are initially sensitive to it, they become resistant very quickly. Radiation, cells also develop resistance to radiation, and it is very difficult to give sufficient radiation to certain tissues because it causes also tremendous toxicity, such as in the lungs. So in the case of Professor Confesor, she already had tumor that came back after surgery, chemotherapy, and radiation. And it spread to her lungs. So since we knew that the development of cancers is often the breakdown of the immune system, what we did then was we used regenerative medicine to take her own immune cells and then train them to recognize her own tumor to be able to restore its ability to keep the tumor in check.
But as the video earlier was showing, all of this Secretary Confesor underwent. But when was regenerative medicine should be considered as a mode of treatment? Like, is it the first or the last option?
We do not consider regenerative medicine to be a treatment of last resort. Since many of the treatments, including chemotherapy, radiation, and even aggressive surgery, could damage the stem cells, these cells that are able to restore organ and function and repair them, we would like to be able to protect these very critical cells from damage by existing treatment. So it should be considered
The first option.
as the first option.
Yes.
It can be combined also with other treatments.
Are there any other cases wherein the patient's condition improved also after regenerative medicine?
That's correct. Aside from cancer, there are really expanding applications to regenerative medicine. Many of the diseases afflicting humans are the result of breakdown of cells. Basically, it's a cellular problem.
Okay.
Take the example of diabetes. You know, in spite of insulin treatment, the cells break down in the brain, in the heart, in the kidney, and even in the legs because of the problems of the cells in the blood vessels. So even with insulin treatment, these organs often break down. Now, with the new methods of being able to get the patient's own cells and to recreate these blood vessels, we are able to interfere with the progression of the complications of diabetes. We have experienced this already with a number of patients at the medical city, where patients who had severe diabetes on full insulin treatment had multiple complications of diabetes, and we were able to reverse these side effects. Now, just like with cancer, it should not be a treatment of last resort.
Yeah.
We should consider this as even as a preventive way to be able to prevent the complications before they occur.
Sounds like a miracle treatment for any disease, but what is the success rate of regenerative medicine, and are there any setbacks that the patients should expect?
Well, in regenerative medicine, there are a number of factors that are more likely that the patient would respond. So, as we mentioned earlier, if the patients are treated at the earlier stages of disease, we have better success rates. If we treat patients whose cells are collected before the cells are damaged by chemical drugs or radiation, we also have a higher likelihood of success. Overall, the likelihood of success that we have experienced is about 40%. So we still have a large number of patients who do not respond, but we think that we could increase the success rate if we have more
people,
awareness
yes.
that it should be considered in the earliest stages of disease.
So, if it's not a treatment of last resort, sir, is there a disease or condition wherein regenerative medicine is really the treatment of choice?
In many forms of cancer where we no longer have effective chemotherapy and radiation does not work, it would be a treatment that would be that should be considered very early on. It would be the treatment of choice, because giving more and more chemotherapy when we already know that the patient's cells are resistant to chemotherapy could do more harm than good.
Yes.
In many other diseases, such as diseases of the brain, for example, such as in Parkinson's disease and genetic forms of disorders in the brain, there are no known treatments. So instead of saying to the patient, well, we have nothing else to offer, in fact, we have now ways to be able to reverse some of the damage to the brain by taking, in the case of genetic disease, not the patient's own cells, but compatible donor cells, either from a relative, or in some instances we would even take it from the umbilical cord. Not just from umbilical cord blood, but from the substance of the cord and many other stem cells in the cord that could actually restore organ function. So there are many of these diseases, not just in the brain, but also in the eyes, in the heart, in the liver, in the lungs, in the kidneys, in the bones, which we now have an increasing number of avenues for us to be able to help patients, not necessarily cure them. We're not promising cures, but at least to alleviate suffering, and in some cases to be able to prolong life, and to, most importantly, to improve the quality of life.
Well, I like that, getting donors, you know, like if I want to be smarter, can I just get brain cells from, you know, a smart individual?
More about regenerative medicine after the break, plus our studio audience, a few questions to ask our expert guest here, Dr. Bernal. Keep it here. Talk to Doc. We'll be right back.